the couples who are pregnant, can they have sex when their partner is pregnant? Is sex safe during periods? There is a couple who's trying to actually conceive, and when they fail even after multiple treatments, the blame is always often on the woman. Is there a medical evidence behind it? Why is that happening?
When we have male infertility, even the females, they are reluctant. Even with your mother-in-law, who might be accusing her, you're not going to make children, you can't make children. And the problem is,
those women who have delivered the babies, they go through this stage called as a postpartum.
she feels, she's bleeding, she went through 9 months, she's no longer with a partner. In our society is that many girls, they don't have anybody to speak to about their periods, whether the period is considered dirty.
Are these menstruation cups, tampons, sanitary napkins safe? Why do periods stop when a woman is pregnant? What happens in her body? Worst thing that can happen when a pregnant woman smokes and drinks. According to the World Bank, 54 maternal deaths per 100,000 live births. Adolescent pregnancy still at 36 of 1,000 girls in the Caribbean. According to the MedSci discovery, period poverty in the Trinidad and Tobago is recognized among the emerging concerns. Welcome to Medicas. My name is Varun. I hope you're all doing well. Now here to talk about women health. That includes all the aspects of women health in the Caribbean region. That includes Trinidad and Tobago, Jamaica, and few other Caribbean islands. We have Dr. Randall Gooding, who's got tons of experience, decades of experience as an obstetrician and gynecologist to discuss this topic. Let's welcome him on board. So Dr. Gooding, firstly, thank you so much for accepting our invite to join this discussion, because though we are evolving as a society, there is still a lot of stigma, there is still a lot of taboo, there is still a lot of illiteracy when it comes to women health. There is still a lot of cultural differences we see in women health all around the world. It's very essential. The most important aspects that is actually hampering the healthcare nowadays in women health needs to be discussed and addressed, and all the misconceptions needs to be cleared. So I really have to thank you for taking the time out of your busy schedule, being a very busy doctor, and educating our audience about the women health. Once again, appreciate your time, sir.
Most welcome. I'm
Great.
privileged to be here.
Thank you, sir. So, ladies and gentlemen, this discussion that we're going to have today, viewers' discretion is advised. There will be some topics that we are going to discuss which may not be appropriate for certain age of audience, especially below 16 years. There will be certain topics that may not be advised to watch with a family. They may be appropriate to a certain segment of audience. So please watch out when you watch this video in public. Of course, we are only going to confine ourselves to women health, and it's all related to medicine. However, please make sure that the viewers, whoever is watching along with you, are of the age qualified to listen to this podcast and also view this podcast. So, Dr. Guri, the first question that I want to ask you, this is a strong subject, but this is actually like the underlying question which many people will not be asking, or many people will have it in their mind, but they're having the social stigma to take it out or probably to discuss about that in public. But I'm going to ask you straight, Dr. Gooding. I hope you are okay with it. If there is any question that you feel that is not appropriate to discuss, please feel free to let us know. We will skip that and we will move on to the next one. But this is one of the common questions that we have identified. The most important question, everyone knows that women attain puberty and they start their menstrual cycle after a certain age. The most important question that we have been hearing from a lot of adolescents as well as young teenagers is sex safe during periods? What are your thoughts on that, sir?
Some women consider that, is the first time having a partner, they're in the mood, it's okay to have sex. Generally, women who agree to have sex during the period, generally, they may not mind it. There is also a problem in terms of, like in my practice, what I find is that a young male hooking up with a female, they may be okay as boyfriend, girlfriend to have sex during a period or during bleeding because they feel that that's the opportunity. They don't want to if let that moment pass.
Right.
On the other hand, in married couples and everything, you find then they even go to the next extreme that they feel uncomfortable to have sex during the period. And
Right.
secondly, even if women have any bleeding disorders or menstrual disorders causing long, significant bleeding, male partners, in other words, who consider that they live in the same home with a partner, they're very, very, if you want to say that, they're very reluctant to have intercourse with their
Right.
female partner during the bleeding. But generally, many people will have intercourse. It will not cause a problem, right?
Okay.
Some people may find it a little bit messy, it a little bit dirty. You know, when you have all the menstrual bleeding and everything, it there may be some odors and everything. But the ones who willing and motivated to have intercourse, they have no problem and they will get through and they will hold hands and do all the cuddling and everything after because they really see that that is their time to be together.
Right, sir. Right. Thank you for clearing that first and most important doubt. Dr. Gooding, the next question is again about the menstruation. So we are in a world where we have a lot of adulteration and a lot of malpractices that are happening, starting from the food, water is getting polluted, the air is getting polluted, and there's a lot of pollution and adulteration that is happening around. And there are a lot of business friendly people that we have around. In order for them to make more money, they tend to malpractice certain manufacturing practices and delivering goods to the public. Especially when we talk about this menstruation as well as periods, women nowadays, I think the greatest invention that happened in the woman's mankind, according to me, you can correct me if I'm wrong, is the sanitary napkins or the pads. And later on, it evolved into tampons and it evolved into menstruation cups. There is again another misconception that is happening in the society that these are chemical contained. They may cause some health related issues in the woman. So, straight question. Are these menstruation cups, tampons, and sanitary napkins safe? And if it is, till how long it is safe?
They are not only safe, they are also essential. I mean, we have women now who are in the work environment, in the schools and everything. With all these type of products, you find it very uncomfortable for a young lady to be outside there with during her menstrual time. Because I mean, even if you wear the undies or anything, you need something to soak up the blood. So most of these products are very safe. They are very helpful. They make women, if you want to say, easy to face the outside world. They are no longer banished into a room into solidarity and everything or solitude when they have the period. Now, the problem is that sometimes these products go one step before. They have a lot of additives. You put in perfumes, chemicals, sweet smells, and all these kind of things that may cause harm to women, itching, more discomfort, allergies. But these products, if you ask me, they're really, really, really necessary and very, very helpful to the modern woman. I
Right.
don't think the women out there could manage without these products in their
Right.
everyday lives, right? But
Right.
if you ask me for my advice, I will say if they want to use these as unmedicated, as pure, like pure as possible, without scents and flavors and all these kind of things. These are the
Exactly.
ones that are corrupting the system and making it more
Exactly.
uncomfortable for many women. But women
Exactly. Making it
hygiene,
fancier.
yes. These really help women in their hygiene and make them really able to come out in the outside world. So no longer, I mean, girls and everything, they don't need to miss any function, education, job, even simple thing like prayer and everything. They are protected. And these sanitary pads and everything as make it, if you want to say, comfortable for women to, if you want to say, to be, and in other words, not to lose time off on work and culture and study and functions because of this, if you want to say, this menstrual design by the creator.
Right, right, right. Thank you, sir. Thank you for clearing that doubt. So when we again talk about this menstruation, sanitary napkins and all, as I quoted at the beginning of this recording, there is this period poverty that has been recognized by one of the journals in Trinidad and Tobago, which means there is still a lack of knowledge in terms of personal hygiene. We are talking about menstruation hygiene. which is observed in the country Trinidad and Tobago. What are your thoughts on that, sir?
Well, Trinidad and Tobago is a very highly educated population. There's a difference between lack of education and financial need. Women, if you understand, who have a good standard of living, have a middle class, a lower middle class, come from working families. Many women, if you want to say, they could afford pads and that's the more common one. Sanitary pads as opposed to the menstrual cups and tampons and everything. Very few women continue to use tampons. It depends on, if you want to say, your socioeconomic. In other words, the wealthier you are, women who are wealthy or women who could afford it, they tend not to reuse pads. So every time they go to the washroom, they will change their pads. There, there are many women who are in the poverty-stricken homes where, in other words, things are difficult. Food is difficult, climate is difficult. So I could assume many of them will have difficulty in other words affording pads. And when they have a pad, they will tend to maximize it, multiple use. So they might be drenched and they need to get that last soaking out of it. Now, what you find is that while we have many aid agencies and everything in Trinidad, yeah, many places you could go and get aid and that. Sometimes what you find is that when there are girls in the home, your food hampers don't come with a sanitary supply. So that is probably, if you want to say, an oversight, because we only think food. We don't think about the menstruating women and the mothers out there who may have, if you want to say, difficulty affording these things. And sometimes in these homes, they have to go back to use like wash rags and old cloths and toilet paper and everything. So sometimes when they go to if you want to say, go to poor environments, poor neighborhoods and everything, you see the toilet paper, people steal the toilet paper and everything. So sometimes it's because they need it for the sanitary hygiene. But the education is there. Most of our young girls and everything, they go to school. We have a lot of social media. Probably everybody in Trinidad has a phone, right? So that the information is there. Pricing of pads and everything has increased significantly over the last few years. And what you find is that there probably might be a good rule for having these sanitary pads and everything in schools and institutions and orphanages and anywhere women visit to make it available and readily available for the female populations who may not be able to afford it. Simple thing in my office. When you come into my office, in the washroom, I have a supply of pads just made there for the ladies. So
That's great.
many of them come with their own supply because those who could afford it, they walk with the pads, right? Because they're nicely packaged and everything. And so you never know who takes,
Right. Exactly, sir.
right?
Absolutely. These supplies
This,
needs to be available to women. I 100% agree with you. And when there is a lot of awareness about it, especially in hospitals like yours, it is actually maintaining the solidarity as well as the modesty of the women. And I have to really thank you for having them arranged and being available for the women that's coming to your office, sir. Sir, on the same lines, Dr. Gooding, there is this another question that has been raising and circulating among the social media. So the question is, how do these birth control and menstrual cycles interact? So the basic question here is, a lot of people say that why do periods stop when a woman is pregnant? What happens in her body?
well, you see that's designed by nature. They have all the hormonal balances and everything that creates the environment where you have a shutting down of the periods and everything because now all the hormones are in circulate is to build up the lining of the womb in planning and in receipt for the pregnancy. And people may not know is that initial building up of the lining of the womb that will eventually cause the period. That is by nature create for the environment to basically cater for a baby, a fetus. And if you don't get pregnant, it will shed and you will get that period.
Okay. Okay.
So if you get pregnant now, that womb will continue to thicken and everything until the placenta forms and all the hormones there, and that's gonna nourish the baby until birth.
Okay.
So the place,
Okay.
the period issue is, if you want to say, however you look for the women who want to have children and everything, it's God's way of making their body receptible to the fetus.
Right, right,
And that's
right.
why basically, in the older days, women used to have many
Exactly.
pregnancies. They'll go from pregnancy to pregnancy to pregnancy, right?
Yes.
And you find then that now when women may have very little pregnancies, they might be seeing plenty more periods than previously.
Right,
And then for women who choose not to have partners or not to get pregnant, you end up with this monthly periods.
right,
And when
right,
you have this monthly periods, like again, when you come back again for the working woman, for the woman who's studying, this period becomes a nuisance. And things that we see in our society is that many girls and everything, they don't have anybody to speak to about their periods. We still go back to the old social taboos and everything, where that the period is considered dirty. They prefer not to talk to the period. So many women, in other words, while they might be openly and very liberal, they may not talk about the period to realize that their period might be different from what everybody is experiencing. And they
right.
may assume that because women put stigmas to period, they assume, okay, but this is what every woman is going through. And if
Okay.
they talk openly on chat groups and everything, you find then that they realize, okay, mate, my period seems to be a little bit heavier than yours or more painful. So
Right,
many
right.
women they don't get the care. Right? They don't
Okay.
get the knowledge. They don't even know what is normal. They just assume, okay, I get the period. Many women, as you know, they hide when they get their
Right.
first period. Especially
Exactly.
people who live in single parent homes. Or you live with a father. How are you gonna tell your father you're starting to have this bleeding and this period and everything? And then
Exactly.
again, many people, many males are uncomfortable to talk about a period. Right? Many
Right.
many males who go to the grocery and everything still have taboos about picking up tampons or picking up
Yes, yes.
pads, right? I mean,
Correct,
many
correct.
people like you remember, the first time when I was a kid and my mother asked me to go and buy sanitary pads. I want to know, like, lady, you crazy? You embarrassing me here.
Yes,
And
I think
and now,
every
and now I mean,
exactly.
I go and I pick up tampons and I pick up pads and everything for my daughter and my wife. But
Yes, yes,
so long ago when I was a kid, imagine a 13-year-old or 14-year-old boy going and asking for maxi pads.
exactly.
You know,
It was a taboo and it was a social stigma
I
back
would
then.
know when you go and I just saying there are so many places in Trinidad. When you go to the pad lane, there's about 10 or 15, 20, 30 brands, size small, thin, wings, no wings,
Yes,
So
yes,
it
correct.
kind of for a male
It's an
shopping for
awareness
a
which
tampon, even when the female shopping for a pad, it kind of hard to choose. You don't know which one to choose. So they tend to probably, you choose it. If you have more money in your pocket, you might buy a more expensive one. If
right,
you have,
right.
if you're poor, you will choose the cheapest one.
Correct, correct. Sir, on the
You know,
same lines, I think you have touched a very important point there, Dr. Gooding. Many women, I think even I have women in my family, when they go to a store, when they go to a departmental store or to a pharmacy to pick up their sanitary pads, the biggest confusion what they have is because there are a lot of varieties of them. It lasts long for heavy bleeding, different sizes and all. I don't know if there is any medical professional or any professional that is available who can guide women as to what is the right sanitary pad for them. This, I think, is the biggest problem what women are facing nowadays. Is there anyone, how do they know which one should they pick and what is the size that they should be picking?
well, sometimes if you ask me, is that pads have evolved a long way. So they're more absorbent. So you get thin one. You get simple ones. It don't be bulky on a female. When you wear your nice clothes and everything, there are all these taboo. You see your pad bulging and everything. They feel so unsure of themselves, so uncomfortable. And then some
Yes.
women, if they have a heavy period, they want a big fat pad because they're so frightened that
Yes.
it will soak through. Because even your peers and your colleagues and other women will laugh at you if you drip blood. Look, I mean, I just
Yeah.
saying is that some women will not wear white when they have
Yeah.
the period.
Yeah.
or light colored clothing because they feel that, if a little bit of blood slips through, it will be very, very embarrassing for them. I mean, women who have period accidents, I call, they become the laughing stock sometimes, even among girls, far less among young men.
Yes.
Where we tend to sometimes make jokes without considering the impact it might make on that young female who would have basically have a little accident. It's the same thing, and then it's the same way, when young men go to buy a condom, they don't know which one to choose. There's nobody, they feel taboo. There's nobody to explain to you, and sometimes the people who there, they don't want to tell you, okay, we have these brands. Whereas, it will be actually nice where the bigger pharmacies and everything could have product care experts who could come and sit down table, not in front of everybody, but in a little room, like how like if you're going for makeup and everything, they put you in a room on a table and they could show you, okay, we have this brand, because all the big brands have all the varieties. And they could
Exactly.
kind of say,
Exactly.
a little picture chat, okay, this is the kind of period you have, and they could really help these young girls and everything.
Yeah.
Where I have done outreach programs and everything, I have talked about women's health. I have talked about period issues and everything. But coming from a male, sometimes it's nicer coming from a female, you know?
Exactly. Yes,
Yeah.
absolutely. And the comfort level what you have when you talk to your same gender about something which is so private to you will actually help you open up and get a right and appropriate solution. I think that is obviously there, Dr. Gooding. Thank you for clarifying that. And now, the next segment that we have is more to do with PCOS. I think this has been again a very big issue which is happening around the world and also in the Caribbean. There is a misconception that PCOS happens only to a overweight woman. Is that really true?
No, the answer is no. PCS starts in the young, slim woman. And then by the time, so in other words, you may start off young and slim with polycystic ovarian. And
Okay.
as you develop more and it worsens and everything, you put on weight. More social outgoing, in other words, get most of the advances. And in other words, it goes unrecognized. And as it goes unrecognized, then you start to put on the weight and all the other effects of the polycystic ovaries. The facial hair, the acne, the deepening of the voice, the irregular periods, the mascularization of the face and everything. And because polycystic ovaries grows in families, in other words, is a genetic link to it. So you
Exactly.
might
That's my next question, actually. Sorry to interrupt you. I was about to ask you this question. Is this PCOS hereditary? Because I haven't, or we haven't heard about this PCOS back then. I'm talking about a decade ago or 2 decades ago. Or maybe it was there, but we do not know it was a PCOS. I don't know. You need to clarify that. But is this hereditary?
So the answer is yes, in the sense that it's not like one particular gene, but the general teacher now is probably due for a mixture of genes. It runs in families who have diabetes.
Oh, okay.
So
But I
women
think everyone
who have
nowadays has.
diabetes, they have a higher incidence of having polycystic ovarian syndrome.
Okay, how about this, doctor? So I mean, nowadays, a lot of people have diabetes. There is no family which does not have diabetes in them. Now, what are the chances of those families that have diabetes also has this PCOS?
So what you find, it is a very high chance, because actually women with polycystic ovarian syndrome and everything, in 20, 30 years, they have an increased risk of developing diabetes and heart disease and all the other things. The problem is because it runs in families. People think, in other words, this is, in the local term, we are a big breed family. We are a little more hairy. So you grow into your aunties and you grow into your mommies, and everybody, in other words, the overweight is not a problem. The facial hair is not a problem. The acne is not a problem. You see? Because your family looks like that. So they go on and they put on more weight and all the other things that makes diabetes more likely. So they will develop diabetes at a earlier age and at a younger age than the other women.
Right, right. Got it, sir. Now, what is your advice for either a lifestyle or it could be for a diet? Because for those women who wants to maintain their hormone levels in the body, because everything is now tagged along with the hormones, right? So, what advice would you like to give to them?
So the first thing with it is one is that on your own, if you do weight control, exercise, diet, that is the most important thing, right? I say a simple thing. No matter how small your home is, if you can walk around your home about 20 times, at least 5 times a week at a pace that will sweat. In other words, your home and your environment, no matter what it is, any little exercise. Because sometimes when women working, they reach home tired. Park far from the workplace. Do more walking your workplace if you could. You're working on a ground floor. If you can take these steps, all these little things to increase any form of activity. I also tell women too is that sexual activity is also a form of exercise.
Oh,
For the older women, the women at home and everything, gardening, right? So not everybody enjoy exercise as we know traditional exercise, but gardening, planting, doing construction, raking up, cleaning up, doing a little project, all these little things are different forms of exercise.
okay, okay.
Because women going to the gym and everything, one, that's expensive, and secondly, women need to look at certainly fashionable to go in the gym. Gym clothes are very expensive,
Expensive, correct.
and you
We
have
we are we
guns
are
when you
we are
get in
now
school, you know.
exactly, sir. We are now living in an era where we live to impress someone else. So our gym
Right.
clothes are expensive, our
A
cars are
simple
expensive, our
bicycle,
phones.
a little bicycle, all these little things you could do, walking a little bit for those who live close to the work environment and everything. But again, we have a modern culture. You
Correct,
see, and you have expectations. But again, you
correct,
work in life is harder for the working woman because
correct.
they reach home tired. Sometimes they
Right,
reach home and they are mothers, they need to care for the children, they need to make dinner and everything. So sometimes, 9 o'clock, 10 o'clock in the night, get in a shower after work. It's
right,
very
right.
difficult after that to go and exercise.
Okay, okay. Got it, got it. Thanks for that advice. Dr. Gooding, we are talking about PCOS as a medical condition. So what happens if this PCOS is untreated?
Well, again, so that's why I say you start to put on weight. You start to get irregular periods. You start to get acne. You start to get facial hair. Your facial appearance change. Your voice deepens, masculine features. And again, for the women who develop polycystic ovaries early, they may have more difficulty getting pregnant.
Okay. Well, when you start taking the treatment for PCOS, will we retain or will we go back to what our voice was and our facial features were? Will I reduce those facial hair and all? Or there is no reversal, it is just maintenance of whatever it is currently?
The facial hair and the acne after simple treatment and exercise and everything between 8 months to a year, you can tend to correct a lot of the features.
Okay.
Right? When you start to change that, and I always advise my younger women when they now start to put on the weight, they reach now 140, they reach 150. I always tell them that the 200 comes in the blink of an eye. When the 200 to 250 come and that face start to become wrong and a mood, it's very, very difficult to start to change it back. Even when you go to the diabetologist and everything, everybody talking about um, gastric bypass surgery and all these kind of things that are
Yes.
unacceptable to many people. So what you find is
Yes.
that the main thing is to catch it early. The main thing is when you see the mothers who have the condition, they need to get the young ladies and everything to come to see the doctor to start the preparation. But if you
Right.
ask me,
Right.
it's one of the most simple disease to treat and manage. Yet so many women they do not get care.
Correct. Correct.
And
Well, it's, I think,
with simple diet and exercise, you could almost do it on your own.
oh, that's great, right? So, I mean, everything is linked up to your lifestyle as well as your exercise. You're putting your body to sweat, and what you put in your body in terms of consumption of food is what comes out either as a good output or it could be something like PCOS. Thanks for that advice as well, Dr. Buring. Dr. Buring, this next segment we are going to talk about is going to be very interesting to a lot of our audience. You mentioned one statement at the beginning of our podcast. Back then, women were always pregnant. They used to have pregnancies after pregnancies. They gave birth to a lot of children, and every family used to have multiples of two, or it are either four and all. Even we used to have that, in my grandmother's and great grandmother's family. Now, I think the biggest issue what most of the youngsters and young couple are having is conceiving, right? The straight question is, when should the couples stop worrying about conceiving?
It depends, right? Most women will generally conceive by 2 years, right? But now we into getting what you want. So you find that many women are delaying families and everything. That they just 30s, the working women, the educated women, the women who are choose academia and everything. So when they do get pregnant in the 30s and everything, they feel it's a little bit rushed. They feel something is wrong with them. So most of them, they get frustrated easy and everything. How you handle stress and everything. Sometimes that simple things is that you live in a wonderful union with a wonderful partner, and when you ask is that, well, we don't be able to have sex. We love one another. We'll do anything. But sometimes just because of how the work schedule and everything is that, a common thing. I mean, I have a wonderful partner when you ask them, but we don't get to have sex. You see? So
Correct.
so sometimes they're not even having sex and they expect to have children because they
Exactly. I mean,
assume they get married. So sometimes a
exactly.
simple question like that. But I we say no, normally, a young woman under 30, right? You give it a 6 to 8 months, right?
Hmm.
Even women under 35, you give it a to see that. And if you have problems, you're thinking that sometimes coming and getting advice from our friend, even if they tell you that nothing is wrong, it helps them. It motivates
Okay.
them. Because sometimes
Correct.
just like how the modern youth, the modern individual, we can't cope with stress. So
Correct.
you're not getting pregnant, that is too hard. Okay, we don't want no children.
Okay. Okay.
You see, and
Okay.
then again, sometimes simple things, sometimes people see non-experts. And
Okay.
a common thing, like how we were just talking about polycystic ovaries, there are many women who are started on a birth control in the 18 or the 20s.
Correct.
And
Correct.
they are not told that they're on a birth control because they were young, they were not sexually active. So they put you on this hormones, right? So everybody packaging, we put in here to control your hormones. And then
Correct.
they might come, doc, I'm not getting pregnant, but you're on a birth control. So the
Correct.
birth control
Correct.
is working, so you're not getting pregnant.
Correct.
So sometimes
Correct.
these simple things is that because you never ask questions. Sometimes your parents talk to the doctors.
Right.
One
Right.
thing I
Right.
like to do, even in my young female, I like to talk to them too with their parents, but at least I hear what they talking, and they're educated. They put the app on the phone. They do that. So the ones who come, and if I think is that all prepubertal women should come to the gynecologist because
Correct.
sometimes
I I agree with you, sir.
those are the only people who could give you educated. You come before you get your first period, so you don't become as a shock. You don't want to cry. You're prepared. You know what's going to happen. You see the breast bud starting here. You know your period gonna come soon after. So they're prepared. All these simple things. What's gonna happen? Do I need medication? When to see a doctor? So sometimes we talk about preventative medicine. So sometimes if you ask me, we could talk about preventative gynecology.
Correct.
Right?
Correct.
Because
I 100% agree with you on that. Just like how we frequently visit for our routine checkups in a hospital, I think it's important the parents also take young female childs to the gynecologist, at least to get that confidence that this is not abnormal, this is normal. These are some best practices you can follow. These are some things that you should not be doing. And obviously, when it comes from a qualified doctor, it's most likely they're going to take those advices and incorporate in their lives. So, doctor, again, coming back to the conception, we are talking about conceiving. What is the best age group for the couple to conceive with minimal risk, according to your experience?
below 35
Okay.
is normally comfortable for easy,
Is it for
right?
both men and women, or are you gender neutralizing it?
Well, generally, most men will be able to have, in other words, when you're looking at men will be able to have children much later in life than women. So the
Oh,
male menopause is a total different thing from that woman. So you might find a 60-year-old man could father many children, where
oh,
after he becomes 40, it is more difficult for a woman to get pregnant. Yeah, greater risk of Down syndrome and chromosomal abnormalities and everything. So I would say it's best, it's not impossible, it's not bad, right? Because again, for women, the women who are the academics, the women who are the head of society and households and everything, the women who are unfortunate to get married later in life, they could still get pregnant. And this is more might could be a as opposed to a gynecological, a social question. It's probably better to get pregnant when you're at least working and you could take care of a kid.
Okay. Okay.
You
Correct.
know,
I mean, I agree with you. Correct. Correct. Because it's not about just getting pregnant, but also are you able to take care of the kid? Give time to the kid once you're pregnant also. But thank you
and
for
then
that
and
answer.
then I the next thing too, we now live in a society where we have the extended home and the working grandmothers and the grandfathers. So
Yes.
even though
Yes.
to provide that caretaker for your child, long time, right? In the older days, you make children and your mother and your father will take care of the children and send
We'll
them to
take care of
school and
them.
everything while you work. Then
Correct.
most times the wives were not working. So now you have the wives working, the mother working, the grandfather working. So there is nobody to care for the child.
Exactly.
And then
That's what is happening.
you know, daycares around the world generally is a lot of hit and miss. When you bring people
Correct,
to
sir.
take care of a child, sometimes you're frightened because you read society, you read things, you kind of mistrust. You're frightened if anybody will interfere with your children, you know. So, all these you have to kind of plan out. In other words, when I get pregnant and I deliver this baby into this world and all the joy, what happens when I start back to go to work?
Correct. No,
So we
that's
still
a
in
very
Trinidad, the
crucial.
working women still get 14 weeks off in Trinidad.
Correct.
But
Correct.
even after that, some many women will come, doc. What I will do? I have nobody to take care of my
Take
kid,
care. Exactly.
and they can't afford not to work.
Correct.
But the
Correct.
same
Correct.
thing will be at age 1, 2, 3, 4, 5, 10.
Correct. Correct.
You need somebody to take care of the
To look
kids.
after the kids. Correct, sir.
You know,
Correct. Men contributing to the pregnancy can also happen at the age of 45 to 60 years, but for women, the ideal age is 35. And you also mentioned about families becoming nuclear, unlike what it was earlier, like we had joint families, and there are no one to take care of the kids after a woman gives birth to a child. Even she's so scared that what happens to my kids if I start going back to work, if I start resuming my work. Now, the question here is, sir, though you don't have anyone in the family to take care of the kids, or even when there is a couple who's trying to actually conceive, and when they fail to conceive time and again, even after multiple treatments, the blame is always often on the woman. Why is that happening? Is that a social issue, or is there a medical evidence behind it that women are more less reproductive than men in these times, in these modern times?
the official statistics tell you that infertility is sometimes 30% male, 30% female, and 30% both.
Okay,
So it's
okay,
almost balanced off,
it is.
right? Is the other thing is that society, they see the mother as the one to bear the child,
Mm-hmm.
right? And then again, when we have male infertility, even female, right? The females, they are reluctant to come forward and say, well, there's a problem, even with your mother-in-law, who might be accusing her, hey, you're not gonna make children, you
Exactly.
can't make children, and the problem is your son. So women, if you're out of love for the partners or out of commitment, they don't want to demasculinize their husbands. Now,
Correct.
with Trinidad, we have a problem in the sense that while we have infertility treatments and everything available in the private sector, it's very expensive.
Oh,
And in the public sector, we have no infertility treatment in terms of IVF and everything. So we could only
okay,
do basic. So the poor woman in Trinidad, in other words, they have no avenue for IVF. So
okay,
so one is a lonely road. It's a difficult road. So when you have IVF patients and everything, there's plenty of visits to check, to do all the kind of things to manage that pregnancy, and it's low rewards. Now again, when there's a genuine problem that requires IVF, what you find is that even in the private practice, right? What you find is that they can't afford, right? Many women who will come to my private practice, they can't afford IVF. When you send them to the IVF specialist, it's too costly.
Okay.
And
Does
then
it
the
not
other,
cover in insurance, doctor? Sorry to interrupt you. Does it not cover under insurance?
no, very little. And many of the women who comes, right, they don't have private insurance.
Okay. But
And
does it
then,
cover under
and then,
private insurance at least?
what?
Does it cover under private insurance?
Very few.
Do you think it should cover? Do you think it should cover because this is a genuine medical treatment that women or men undergo? I'm talking about fertility related
Sadly
treatment.
enough, sadly enough, insurance plans, right, at least the ones we have in my country, in Trinidad and Tobago, they cover very little in pregnancy and childbirth in the first place.
Hmm.
So they have a maximum coverage of around $5,000 for the whole
Okay.
pregnancy. $5,000 will hardly get you out of the second trimester.
Okay.
You see, so even though you have insurance, most of the pregnancy issues, and even when you come to having, other than you have an emergency cesarean section, some of the
Hmm.
plans will pay for emergency cesarean sections, but they will
Hmm.
not pay for normally very minuscule.
Okay.
So they run out of insurance very early
Very
in
quickly.
a
True.
pregnancy. And the same thing
Correct.
with IVF, the treatments and everything is very expensive, and the plans that cover it, they cover very little.
Right, sir. Right. Now, when we talk about this IVF, there is one thing you've already cleared that this is a very expensive task, and a lot of women who are economically backward may not be able to afford. And it's not just women. I'm talking about couple who are economically backward may not be able to afford fertility, so they end up with no children or maybe adopting a children from outside. Um, Now, there is this misconception that is also being circled around in social media that I'm not sure if in all places revealing the gender is legal, but in some countries gender revelation is not legal. So let's assume the woman somehow knows that she's bearing twins. There is this thing that elders in the family say you need to eat for two. Like, let's say if she's interested in eating one banana, she was told to eat two bananas because it goes to two kids that are there in her womb. Is that a myth, or is that
Yeah,
really true that
that's
a
a
woman
that's
who
a
bear?
big one. You don't need to eat for two.
Okay,
Right? You
okay,
just need to eat for yourself,
okay.
right? The pregnancy is almost that unborn baby is the, other than you need to go for your checkups and everything. You don't need to really eat for that unborn baby. Most women
Okay.
will get through the pregnant having the normal traditional diets. The women
Okay.
who smoke and they drink alcohol and then we tell them to refrain from that within the pregnancy as much as possible. But in terms of the special diets, and they need to eat double and everything, because you don't want to put on too much weight in pregnancy, because they get all the stretching and all the bloating and everything. It's difficult.
Correct,
So you
sir.
don't
Correct.
need to eat for two.
Thank you for that. So
And then
when
I
we're
also
talking,
tell my women is that, especially in the first trimester, when you have nausea and vomiting, sometimes you just need to eat what you could.
yeah,
Because not
correct,
all
makes
the foods
sense.
are tolerated and everything. Sometimes it is all you need to do is eat for sustenance, because you're nausea, you're vomiting. So you try balance that. You need to stick to foods that is going to stay down, so that
Correct.
you don't feel overly depressed, and you're vomiting and you're sick and you're weak and you're tired. It's very difficult for many women.
Correct. Eat what you can keep. I agree with you on that, sir. Smoking and drinking is generally very harmful. But when a pregnant woman smokes and drinks, doctors say that it also affects the kids. Why do they say that? Can you really tell me what is the worst thing that can happen to an infant when a pregnant woman smokes and drinks?
Well,
Maybe
what
just
you
to.
find that when you have women who are habitual smokers and everything, we have a lot of room for, if you want to say, a poor placentation. And they can lead to smaller babies, not well grown babies, premature labor, right? They have, more feeble looking babies and everything. A bad, not well developed placenta, leading to earlier preterm birth, preeclampsia, right? problems of delivery, babies in the NICU. So that's smoking. So smoking generally is very bad. Now, this is not for the woman who smoke an occasional cigarette. This is for women who generally consume a significant amount of cigarettes. Also, you have a
Okay.
marijuana and everything, which is something that in many populations becoming more popular. So
Mm-hmm.
we have that in Trinidad also. The alcohol, the occasional alcohol consumption is all right. But when you have a lot of alcohol consumption, you have fetal alcohol syndrome, where there are a lot
Okay.
of problems with the babies, the growth and malnourishment and underdevelopment and syndromes in the bodies and everything. So it's really, really harmful for
Okay.
and then remember the alcoholic woman is not the woman who is going to be well nourished.
Right.
She's
Right.
already going to be deficient and everything. Now this is different, and I always tell my patient, if an occasion come and you have an occasional glass of wine or a small amount of wine or a small sip of beer or anything, that's generally not gonna. There's no good evidence that are gonna harm. But with
Okay.
general, the thing is that we stay away from that. I also
Correct.
tell the woman is that you make your husband smoke outside.
They don't become passive smoker. Got it, sir.
Right, because sometimes you're lying in an environment, and if you're, I mean, my general thing with smokers, they have no respect. They want to light up anywhere they are. They light up at the
Yeah.
dinner table anyway. To me, it's a nuisance. You're having a dinner, and they decide to smoke a cigarette and flick the ashes. So me
Yes.
being
Yeah.
a
That's
non-smoker, I hate that culture. Even in my home, you're not allowed in my four walls if you're smoking. You need to smoke outside
right.
in your car.
Correct.
You
Correct.
have
Correct.
guests in my home who smoke
Right.
because
Right.
it,
Got it.
to me is I respect your way, but not in my property or in my car.
Correct, sir. Correct. Correct. Thank you. Sir, we initially we spoke about sex during menstruation. Now the question is, there is a data. I'm not sure how genuine the data was. A lot of men, they incline towards extramarital affairs at the time when their wife is pregnant. So, so maybe this will help the couples who are pregnant. This question: can they have sex when their partner is pregnant, and how safe it is?
Sex is very safe and very enjoyable in pregnancy. Actually, some women feel a little more sexy in pregnancy. Now, sometimes males fear of having sex in pregnant. They feel they'll damage the baby, but they generally don't. So unless a woman having a low placenta, bleeding, or have a problem, you want to get it checked out and you prefer not to have intercourse. For women who have a short cervix, premature birth and everything, and trauma and everything, but normally sex, I normally tell the male partners when she asks for sex in pregnancy, if you don't give it to her, she won't forgive you after the pregnancy.
Okay.
But
Okay.
some people they're just so caring about the wife. They're so excited to have a baby. They feel like they're gonna harm that baby.
Right.
But
Exactly.
second pregnancy is one is enjoyable, it's pleasurable, and it's okay once the woman is not in pain and she's not bleeding or she have any medical disorder that prevents from having sex in pregnancy.
Okay, thank you for that. So we were talking about, see, when a woman goes through pregnancy, that entire journey will have multiple visits to the hospital, multiple checkups, first trimester, second trimester, third trimester. A lot of scans also are necessary at certain stages. Now, people say that the X-rays themselves are harmful, so we should not often get what do you call exposed to them. Ultrasounds are multiplication of what the x-rays can actually give you. So are these ultrasounds safe for a pregnant woman? And if not, what is the frequency or how many times can they get a USG during the entire tenure of pregnancy to be safe?
Well, generally ultrasounds are pretty safe in pregnancy.
Okay.
When you do ultrasounds properly and in for the normal length of period of time that it takes to do an ultrasound, which is generally 10 to 15 minutes for the most, right? It is safe, no harm. So all women who come to my private practice, they will get an ultrasound every time they come because they want to see the baby and everything. So these are small scans, 15-20 minutes for the most, and we see no harm. But is it that So this is one, if you want to say, the perks of a private practice. Like when you go to an hospital practice, in other words, you probably need only about 3 scans in the pregnancy. So you go to a
Right.
hospital, they overburden, they can't give it a pregnancy. But a woman and a partner, they look forward to come to that visit to see the baby. And
Yes.
there's no good data to show that having these ultrasounds is harmful for the baby.
Okay. Okay. Thanks for the clarification. Now we'll talk about something which I think a lot of the elderly population of the women are actually facing, sir, which is postpartum. Is one of the sorry, not the elderly population. I'm talking about those women who have delivered the babies. They go through this stage called as a postpartum, which is the physical changes what they undergo, and the support that they lack in the families, like we were just talking a little while earlier. How do you recognize this is a postpartum depression, what a woman is undergoing after they have delivered a baby?
That's a big problem, right? And especially, right now you're finding that after pregnancy and everything, the woman tends to feel a little bit lonely. She feels, I mean, she's bleeding. She went through 9 months. She's no longer with a partner. She's out of her job. She's out of her comfort zone and everything, right? Because generally in Trinidad, the normal thing is between 35 to 36 weeks, you go on your maternity break. So you're away from your work environment, you're away from your support, you're in your own home now. Suddenly you're maybe with a baby and you're away from your partner who, I mean, the paternity leave is only 3 days, while maternity leave is 14 weeks. So you're finding that these women sometimes they feel, you know what, well, why is he not here with me?
Exactly.
Right? He's leaving and he's going and he's doing everything. And sometimes as men as we do, you have a baby. You know the tradition. You want to celebrate. Your friends want to carry you for a drink or everything in a nice way. So the woman is home alone. Again,
Yes.
she may be feel lonely. She may start to complain. Sometimes she may quarrelsome. Sometimes she may say things like, what is the baby doing here?
Correct.
Or I can't stand being around my baby. The early signs want to lash out at the baby, saying things. So all these little soft signs you need to look out. So even we as
Okay.
gynecologists, when you see the baby, you have to even talk about what could happen in that postpartum period, how to deal with your baby. Sometimes
Excellent, sir.
people are telling you things about your baby that you don't know. In my practice, um, what I do is that before delivery, we let them meet the pediatrician. So they'll have a visit with the pediatrician where the pediatrician will talk to tell them what they expect when you have this baby now.
That's
Because the
excellent concept.
gynecologist manages the pregnancy and manages you and your delivery. And after that now, we generally do talk
Yes.
about how are you going to bond with this baby? How are you going
Correct.
to care for the baby? Now we have a big thing now, everybody trying to push breastfeeding. There
Correct.
are many women, no, breastfeeding is absolutely wonderful, but many women can't breastfeed. So they feel
Okay.
now, if I can't exclusively breastfeed now, they feel a little bit less. They feel, am I harming my baby? Am I causing trouble? They tell me I need to exclusively breastfeed, but I can't. My nipples are hurting, they are cracked, the baby's crying. A breastfeeding baby sleeps very little.
Right.
So a
Right.
mother is exclusively breastfeeding, they may never get an hour or 2 hours to sleep at any one period of time. So it's almost as
Correct.
soon as they close the eye, the baby wakes up again.
Correct.
So comparing that a woman who is bottle feeding her baby and that baby might be out for 2 3 hours so they can relax.
Correct.
You trying to do the correct thing and you feeling the burden. Sometimes you have a unsupportive partner. But again, if you are breastfeeding, your partner can't help you breastfeed.
Correct.
You
Correct.
see, so you have a good partner, they're taking bottle feed. So that partner will get up and mix a baby bottle and put the baby to sleep and everything. The breastfeeding woman don't have that privilege.
Okay.
Again, sometimes too, who you surround, everybody telling you, do this with the baby, do that with the baby. Colloquial things, myths, things that wrong. You have all this information. Even
Right.
when
Right.
everybody come to visit, they want to see the baby, they're passing you straight. Your mother, your father, hey, with the baby. We now live in a modern world where people don't have all that coping skills and in they had before. and depression and stress and everything, it comes by a little bit easier now. Now what we have is good care. And then again, some people will be even reluctant to say, well, well, the baby always crying. I can't cope, because what are you gonna do with this baby? You can't send the
Yep.
baby away. So all these little things. So sometimes when you have people, you have the extended family that we talk about, then you have people that might take this baby for a walk, feed the baby, change the baby, clothe the baby. Now you feel you're so overburdened. And worse yet, for women who have cesarean sections and operative deliveries and everything, they feel burdened and tired and everything. And sometimes, some women just don't have the coping skills as other women. So now see that
Right.
difficult time. So the postpartum period, you
Yes.
have to look for the soft signs. My wife is not being, and sometimes they are marital discord. She just behaving stupid after the baby. So you must
Right.
see,
Right.
you forget who your wife was or who she
Yes.
is. And you see this
Correct.
person being consumed. She want to push you away because she don't want you around, and you just leave, and you just, so she ends up now in this hole that some say that she may have created for herself because she pushed you away. Whereas those
Yes.
are all
Yes.
the warning signs and that's where you need good spouse to realize, okay,
Right.
hey, this is not my wife. I get some attention. Something is not going wrong.
Yes.
But again,
Yes.
sometimes men, again, they think they push me away. Oh, you're behaving so because they get a child. They don't need me anymore because you become emotional too.
Yes. Yes,
You
sir.
don't
Yeah.
know
I
how
mean,
to
as
deal with it. And then
correct, sir.
again,
As you rightly
sometimes the
mentioned.
easiest way to
Yes.
deal with it is to leave the home. And you go
Correct.
by the
Correct.
bar, you go to drink, you go to do something just to, without recognizing that these are cries for help from your wife.
Correct, correct. I think what you've said is making a lot of logical sense to a lot of men around. It's the postpartum depression is not just applicable for the women, it is also to the men. As much as what they undergo emotionally and physically, it is the important phase for men to also be very supportive, to counsel if it is necessary, to pamper, and to accept whatever she is at that phase and seek help whenever it is necessary for her to bring them out of that particular phase. But that's an excellent, I think, counseling sessions which a pediatrician will walk them through so that they can expect the unexpected once you deliver the baby to them. So there are some, rapid fire questions I would like to ask you where this can be very helpful to those people who would like to get some quick understanding about what these concepts are. Vaginal white discharge, is it normal or abnormal?
Right. So the first thing is that sometimes we call clear white. Clear is not white.
Okay.
Okay. So sometimes what we have is that many women they secret a little more discharge, especially around that time of ovulation. And some of women have a little more copious, clear, sometimes mild chalky discharge. That is not no odor, no itching, no scratching, no discomfort, and that's pretty all okay.
Okay.
Now, sometimes we talk about a white that starts to clump, a cream cheese appear, a yogurty appear, and those tend to come with scratching and itching and everything. So that might not be normal.
Okay.
So
Got it.
sometimes I always ask the question, is it, show me what is white?
Okay.
So see, if it's clear like glass, that's all right. That's not white.
Okay.
When
Okay.
it's white like a chalk, that's a
Okay.
difference. So
Okay. Got it,
sometimes,
sir.
and again, sometimes if it's slightly white, could be all right.
Okay. Okay. Great. Thank you. The next question. Vaginal waxing, good, not good?
One of the problems is that some women feel that they like the wax because they wear smaller clothes and whatever, they feel more comfortable. When it's done properly, I see no problem.
Okay.
Recently, sometimes you find that people, just like you get quality or poor quality products and everything, but many times we see wax burns and retained hairs and infections and irritation and really, really ugly vaginas after waxing. So it becomes
Okay.
uncomfortable.
Okay.
So, but again, we see many women who come in totally wax and everything. And I always tell people, listen, when you come to a gynecologist, you keep your area how you have it normally. You don't
Okay.
need no washing, no cleaning, no haircuts, no waxing. We plain and natural that on an everyday basis. So
Okay.
it could cause a lot of problems with irritation and everything. But if it's done properly, women like to be women. They like to keep themselves the same way we tend to want to shave and look nice and everything. Sometimes
Yes.
women prefer that. They don't like that here.
Correct. Correct, sir. Got it. Last question. There are some soaps as well as gels that are coming out into the market, especially for vaginal health. Are they safe or unsafe?
Many of them have irritants and allergies, and they make them the uncomfortable. So for the more sensitive woman, the more sensitive skins and everything, right? And I always tell them, I mean, is that men don't expect a fragrance down there, like a perfume. If you kiss a perfume or you touch a perfume, it's bitter. It's all about in the smell. So sometimes what you find is that the feeling need to flavor up, and sometimes it cause damage, irritation. They bring infections and everything. So
Okay.
it's normally self cleaning. Simple soap and water outside is all as required. It's up to the woman. Many women will use these products and everything. If you tell me it's definitely not necessary for any woman, some women use it because they feel more comfortable. They like that they don't like that vaginal scent, right? Or they have a high odor and they prefer to use these kind of things. Yeah. And then again, some people, instead of realizing that a odor from the vagina may indicate an infection or something that is not right,
Okay.
instead of seeing the doctor, getting an examination, they may go to one of these, if you want to say, these vaginal perfumes. So all
Okay.
they do is mask the problem. They
Okay.
also, I don't know in your culture, but in my culture, you find that many doctors, so the only way you're gonna pick up a discharge and an infection is by inspecting that vagina, open out
Mhm.
that vagina and looking for discharge and swabbing if you see abnormal discharge. But many people, general practitioners, in other words, although you're going to them for the primary care, don't worry about it. Don't worry about it. They don't look down there now.
Got it, sir.
Sometimes if you go there and tell her don't worry about it, you wouldn't worry about it, and you may not go on to see a gynecologist. In the
Right.
traditional method, who have traditional insurance, they wanted to see a general practitioner first who will recommend a specialist.
Correct. Correct.
Right. So
Yes.
if you ask me, I definitely tell women that is definitely not needed.
That's true. Correct. Correct. But thanks for the clarification, Dr. Gooding. Ladies and gentlemen, I think there are some very important topics we have discussed in this podcast. Dr. Gooding was open enough to give us a very clear understanding about different phases of women, starting from the puberty age till the time they've hit the menopause. So we have discussed about various subjects, various very commonly discussed as well as very commonly occurred problems in every household where there is a woman, starting from a girl child till an elderly woman. Dr. Gooding, thank you so much for your time, sir. Ladies and gentlemen, Dr. Gooding is available on our website as well as in Medicas mobile application. The link will be displayed in the bottom layer, and also it will be displayed in the YouTube description channel in the chat box, so that you can have a personal consultation with him, either virtual or online. He will be available for consultation during certain times. The slots will also be available for you to directly book a consultation with him. Once again, Dr. Randall Gooding, it is wonderful talking to you, sir. We will connect with you once again with another very important subject. We'll go a little more detailed then. I'll ask my team to collect as many questions as possible, filter them once again, and have some time from you and discuss them once again, sir.
God bless you. Thank you.
Thank you, sir.